This is the Xifaxan, also known as Rifaximin antibiotic. What it does is it has traditionally been known for travelers' diarrhea caused by E.Coli. Now, it has had information that shows that it is also good now for SIBO, which is small intestinal bacterial overgrowth, and has been known to provide much benefits for those with irritable bowel syndrome, those with diarrhea predominant as opposed to constipation. Now, I picked these up at a pharmacy, and it requires a prescription. Now, the doctor recommends either a period of 7 days on these, or some doctors may even recommend a period of 10 days, 2 pills 3 times a day. So these are the renowned pink round pills, which are made from silex, and as you can see on the pills here, it's not that clear. It has the letters engraved that shows SX, which stands for silex, I believe, and they require a prescription. These are the brand name brands. They also have a generic brand, which also needs a prescription and needs to be shipped overseas depending on where you reside. And so there you have it. These are the renowned Rifaximin or Xifaxan antibiotic pills that has some statistics showing benefits for irritable bowel syndrome, diarrhea predominant mainly. So this is Xifaxan, and typically you'd be using this for irritable bowel syndrome, and it predominantly works for IBS, those relating with the diarrhea symptoms as opposed to constipation. Now, typically you would take 3 times a day, 1,200 milligrams for 7 days. Now, I have gone through and done it for 10 days and 1,600 milligrams, and there has been a number of research articles out there that have noted the differences between the two. It's about a 20% difference, so about rounded off about 60% efficacy for those using 1,200 milligram per day versus those using 1,600 milligrams a day. The efficacy goes up to 80%, and this is the efficacy for reducing the SIBO effect, meaning that the small intestinal bacterial overgrowth is reversed for those using a higher dosage after using a breath test. Now, each one of these little round pills, pink round pills with the SX, these are only available in the United States, and they have been very effective in helping with my symptoms. Primarily all the symptoms related to IBS. And IBS has been more and more linked with SIBO over a number of years of research. And as I've used this for 10 days, it has had huge effects on my symptoms, and many have also noted that it helps to completely reverse their symptoms for a period of time. Now, understanding that a lot have noted that it comes back and it recurs 3 months later, depending on how you have a follow-up treatment program, you may be able to have it in remission for at least a year or even longer. And that's of course if you have a proper follow-up treatment plan after these antibiotics. Now there are some generic versions, but the efficacy of those have not been tested, and these ones here are very costly and often not covered by a benefits program, although some do cover it. And these ones here are 200 milligrams per pill, and it comes in a little bottle, as you can see. And the results for me have been so far very great. So it reduces and virtually eliminates, after using it for a period of 10 days, symptoms such as diarrhea, head fog, a little bit of dizziness, nausea, gurgling, gas, bloating. That's just to name a few, and there is a large number of other symptoms that it has helped with. And so there you have it. Been using these for 10 days, 1600 milligrams per day, so that's about 3 pills in the morning, 3 pills in the afternoon, and 2 pills at night. And been using it for those 10 days and having very good results with them. And of course, having a good follow-up treatment program, as noted, is very, very critical and important, as you don't want to be continually taking antibiotics, as it can damage the environment within your small intestinal tract. And always take probiotics when taking antibiotics to help replenish the beneficial bacteria at least 20 days after the treatment program of Xifaxan. So there you have it. I hope you've learned a little bit here, and best of luck.